University Health's foodFARMacy, a food as medicine model that impacts nutritional needs at the community level.
foodFARMacy is an opportunity for us as a community health strategies and innovation team to do what we always do in community, which is improve and enhance the overall quality and lifestyle of our community members.
With me being the clinical person on our team, it's my job to make sure that we get the participants to understand the correlation between nutrition and chronic disease prevention.
My role with foodFARMacy is to oversee the entire initiative. It's overseeing the produce and the quality of the produce, and it's making sure that the produce is tailor-made for all of our partners.
foodFARMacy trains community partners to become coaches.
What's really special about it is that it allows us to have one-on-one interactions with the clients for some of our community partners. Nurture KC is a great example of that. They have caseworkers that we have been able to train to be foodFARMacy coaches who now are able to integrate nutrition and nourishment elements into their one-on-one interactions with their clients.
My name is Shannon Williams. I'm the Kansas City Healthy Start Program Director at Nurture KC. We work with pregnant women, their children, and their male-involved partners. We partner with University Health so that we can do the foodFARMacy initiative so that our moms are able to get not only fresh produce on a bi-weekly basis, but they also get education that includes healthy recipes, how to care for and prepare the produce as well.
How does foodFARMacy work?
So today we're meeting with one of our community partners that's a part of foodFARMacy, and it's my job today to go over all the education topics with them. I'll also be going over all the biometric results with them, and then just going over the upcoming 3 months worth of education. And we try and do this about every 3 months quarterly throughout the entire year.
The education material for the clients is written in both Spanish and English. It's very easy to understand and includes beautiful visuals so people can easily digest the information and understand it. The goal is to help the client retain this information and hopefully pass it on to future generations.
Meet one foodFARMacy client.
Hi, my name is Paloma Espinoza. I've been a participant of foodFARMacy for over 6 months now. It's been great. Every 2 weeks I go and receive produce that gives me great ideas on new things to try, recipes that I myself would not have known about if it were not for the program.
UMKC School of Nursing and Health Studies tracks the data.
We're looking at some metrics that are a little bit more concrete, some what we call biometric markers. One of the innovations in technology that we're using is a device called a Vegimeter. We're asking them to tell us how many fruits and vegetables that they feel like they're consuming, and then we're also measuring that through a biomarker as a more validated way to measure that.
Some University Health patients also participate in foodFARMacy.
That's really great, actually. Our goal was to reach that 400 level. This is great. Good job, Knuckles. Nice.
We're also looking at electronic health records as a component of this project to see what are some health outcomes related to biomarkers like hemoglobin A1C if you are a diabetic, or blood pressure if you're experiencing hypertension. We're tying into the student learning experience. Students are research assistants, they're interns with the foodFARMacy initiative, and they're really bringing what they're learning in the classroom into practice in the community.
foodFARMacy is a prescription for improved health outcomes.
How our program is different is we're trying to make sure that you are using this food to prevent a chronic disease or to treat a current chronic disease. So why not be able to have funding to write a prescription for fresh produce? That's where the food as medicine comes in for us. We want to prove that food in fresh form, right out of a garden, you can prevent so many different chronic diseases from food alone. So why not provide funding for that?
The goal? A national impact.
So all of those process measures are really helping to support building a model that we can then showcase both locally and nationally to other places so that they can use that as a model to implement in their communities as a sort of produce prescription food as medicine program.
It's been a success. We've seen all the numbers that we want to go up and the numbers that we want to go down have, so it's been great.
I think it's just a really great program, and I hope it continues and that there's other people that that can take advantage of the program.
The data and information that we are currently collecting will hopefully impact policy at a national level. Our team here at University Health, we're just getting started.